Hello, my name is Lori Campbell. I'm a licensed social worker in the Family Caregiver Support Program at Southern Maine Agency on Aging, where I've worked in various roles over the past 30 years. This presentation will inform you about strategies and resources available to you as you help an older family member or friend to plan for their future. It is also good information for you to remember for your future planning, since we are all aging every day. So, who is considered a family caregiver? Many family members don't think of themselves as caregivers. They are just helping out an older person. We think of a family caregiver or care partner as an unpaid family member, friend, or neighbor who is assisting an older adult. This person does not need to be a blood relation. The assistance that family caregivers provide can be in a variety of realms, offering emotional support, doing the grocery shopping, helping with finances, managing medication, providing help with personal care, and so on. You do not need to be providing hands-on care to be considered a care partner in helping an older person to remain as independent as possible and living in the setting they desire. As you can see from this slide, family caregivers provide the backbone of elder care in the United States. Without the support and assistance of family and friends, many more older people would be forced to move into a congregate setting to receive the care that they need as they age. This being said, it is important for the older adult to explore all care options available to them, rather than relying solely on family members who may or may not be willing or able to provide the level of care that they need as time goes on. So why start planning ahead? Well, now that we've established how important family care partners are, let's talk about why it is important to plan ahead for elder care needs. Well, you want to make sure that the older person's wishes are known. You want to maximize their choices, address any concerns, engage reluctant family members, allow time for wait lists and other delays, anticipate financial situations, and plan before a crisis occurs. Planning ahead allows families to have those sometimes tough conversations about care options, financial resources, and end of life wishes with the older person. It allows these conversations to happen before a health crisis occurs, so it is proactive rather than reactive. It allows time for legal and financial planning. It allows you to think about what the older adult's care needs are right now and what they might be in the future. No one has a crystal ball to plan for every contingency, but many aspects of elder planning can be set in motion now to make things easier for the future for everyone. So, where to begin in this planning process? Well, you want to listen to what the older adult wants and accept their right to make decisions. You want to try to build a collaborative environment, prepare for the future and prevent things that can be prevented, review options objectively, and do your homework. As much as possible, plan with rather than for the older adult. Consider their interests and preferences, as well as what their care needs might be in the future. Be realistic about how much family support will be available to the older adult going forward. Avoid making promises that you may not be able to keep, such as promising never to place the person in long-term care. The older adult may need to bring in outside care to supplement what family and friends can do. It is important to have that conversation and set that boundary before a crisis occurs. Many family members find themselves on a slippery slope, providing increasing amounts of care as time goes on, which may not be sustainable or desirable. Learn as much as you can about the home care and long-term care system in Maine or wherever the person lives. There are 5 agencies on aging in Maine set up by region. There are elder resource agencies in all 50 states. You can search online through the Elder Care Locator for the agency on aging nearest to where the person lives. You also want to make sure that the older adult has completed a will, an advance directive, including naming a healthcare proxy, and a durable or financial power of attorney, so that medical and financial decisions can be made by a trusted person if the older adult is unable to speak or act for themselves. So, how to help the older person to think about their own future? Well, here are some questions. Where do they want to live? Has their home been evaluated for safety and security? How will they access the services that they might need to remain in their home? Do they have all legal and financial documents in place? And do family members know where to find them? And is there a plan B in place if the primary caregiver is unable to provide needed care? Studies have shown that 96% of older adults in the United States would like to remain in their own homes if at all possible. As a family care partner, your job is to have a conversation or many conversations about how to set up the needed services and supports to make that desire a reality, if it is indeed a realistic goal. Families should also have the conversation about what might happen with the older person if their primary caregiver is incapacitated, temporarily or for the long term. If the older person has a progressive dementia or other debilitating disease, he or she may not be able to live alone safely without the primary caregiver. The family must have a contingency plan in place to deal with that scenario, or they will find themselves scrambling. Involve other family members. In planning for elder care, you want to maximize family communication, even for those really tough conversations. You want to allow for acceptable risks, know your own abilities and limits, share the care, balance giving and receiving, and think of it as a journey. So you want to try to practice regular family communication before a crisis occurs. Identify who in the family is willing and able to help and on what level. Include everyone chosen by the older person to be a part of those conversations. Remember that this process is a journey. Things will change as you go along, and you will need to reevaluate strategies as a result. As long as the older person is able, he or she should be the primary decision maker. This means that the care partner or partners may need to live with a level of acceptable risk with regards to decision. As long as the older person's safety isn't compromised and they aren't endangering other people with unsafe driving, for instance. It can be hard to sit back and watch an older person make decisions that you would not make, but it is their right to do so as long as they have that legal capacity. Navigation is more important than speed. So spending time at the beginning of this process to understand the older person's situation and options will serve you better in the long run than rushing into action without a plan. And this slide just shows that making a plan is a circular and constantly evolving process. You're always going to be reassessing and making a new plan as time goes on. So, what to assess? It is important to regularly assess how the older person is managing in all of these areas of daily living: physical health, cognition, mental and emotional health, self care and home management, meals, shopping, errands, chores, money management, and driving and transportation. The care partner will want to help the older person arrange for a complete medical evaluation if the older person is experiencing any changes in physical health, cognitive functioning, or mental or emotional health. Many conditions common in older adults can be treated or changed, so it is important to get a thorough medical workup to understand what is truly going on. Don't ignore symptoms or let the older person downplay changes or try to diagnose themselves. You want to pay particular attention to increased falls, the inability to manage medications, the inability to manage chronic medical conditions, increased confusion and forgetfulness, unpaid bills, unopened mail, missed appointments, withdrawal from social activities that the person used to enjoy, changes in appearance or grooming habits, lack of appetite, spoiled food in the refrigerator, and the inability to manage the home environment. All of these changes in functioning are potential red flags which should be addressed with the older person and which may require intervention. Part of the process of planning for elder care is to be aware of these red flags and make a plan to address them if they occur. We will now discuss each category in greater detail. Assessing physical health. Is the older person in stable health medically? And do they see a doctor regularly? Is there an increased incidence of falls? Can the older person manage their own medications? Is the older person overusing alcohol or prescription drugs? Be aware of these signs that the older person's health may be at risk. Consider their ability to manage their medical appointments and their medications. Do they understand when to take their medications and what they are for? There are many assistive technology products on the market right now, such as automated medication dispensers, that can help an older person to keep track of when to take their medications. Falls are one of the biggest risk factors for an older person being unable to remain safely in their home. According to the CDC, 1 in 4 people over the age of 65 takes a significant fall each year, and less than half of them report that fall to their doctor. Each year, over 3 million older people are treated in the emergency room for fall injuries. The doctor can request an evaluation of the home environment by an occupational therapist who can make suggestions about ways to improve safety and mobility. This is usually covered under Medicare. Many falls are preventable if safety measures are implemented. Alcohol and substance abuse, including prescription drug abuse, in the elderly is often called the invisible epidemic. It is important to keep an eye on signs that this is occurring and intervene as necessary. Assessing cognitive health. Many older adults become very fearful and defensive about changes in their cognitive functioning. Cognitive changes in older adults are not inevitable, but often do occur. These changes can lead to increased care needs and possible facility placement. Our cognitive functioning tends to slow as we age, but many people are able to compensate for that and function perfectly well. However, if changes in cognition are affecting an older person's ability to function successfully in their daily life, that is a cause for concern. For instance, are you noticing that the older person is not paying their bills or missing appointments? Is the person getting lost on familiar roads or having multiple fender benders? Are you noticing changes in the older person's personality, such as becoming withdrawn or acting belligerent? Are neighbors and friends expressing at how the older person is not functioning as well day to day? If so, it is important to seek medical attention. There may be a need for a comprehensive cognitive evaluation. As I mentioned earlier, it is very important to find out if these changes in a person's thinking abilities are treatable and reversible, or if the person is dealing with a progressive, irreversible condition. If you are noticing cognitive changes in an older adult, encourage them to first make an appointment with their primary care physician to rule out medical conditions which may be causing cognitive changes. If warranted, the PCP can then recommend further evaluation by a neurologist or at the Maine Medical Center Geriatric Center to pinpoint the exact cause of these cognitive changes and suggest options for treatment. You can alert the physician ahead of time about the changes that you are observing in the older person and ask them to do some screening tests based on these changes. Most physicians welcome information about how the person is truly functioning outside of the doctor's office. Assessing mental and emotional health. Are you noticing a change in relationship patterns? Is there a loss of interest in previously enjoyed activities? Is the person experiencing hallucinations or delusions? Or are they dealing with ongoing or overwhelming grief? According to the National Institutes of Health, quote, depression is a common problem among older adults, but it is not a normal part of aging, unquote. The ongoing pandemic has certainly exacerbated loneliness and isolation for older adults, increasing the incidence of depression and anxiety. Encourage the older adult to talk to their physician about any of these emotional changes. There are effective treatments for emotional distress if the person is willing to try medication and or counseling to address these issues. Older people do not need to suffer with emotional distress, but many are reluctant to talk about these issues due to the stigma associated with mental health. Assessing self-care and home management. Are you noticing neglected personal hygiene, dirty clothes, an unkempt appearance? Is the older person able to keep their home clean and tidy? Is there an accumulation of unopened mail, newspapers, or trash? Are bills being paid on time? If the older person was always well groomed and they are now wearing dirty clothes or aren't bathing regularly, that is a red flag that something is going on. The older person may be afraid to get into the bathtub or shower for fear of falling, or they may not be able to manage their laundry any longer. In many older homes, the laundry is in the basement and the stairs can be dangerous to navigate. The older person may have limited income and be afraid to open bills that they cannot pay. Or they may be experiencing cognitive or vision changes, which make bill paying difficult. Some ways to mitigate these obstacles would be to install grab bars in the bathroom and get a shower seat so that the person can sit down if they need to. The person may need to hire someone who can come in and assist with the laundry if they're not able to do it themselves. You might encourage them to have someone assist with the budgeting and bill paying, although they may want to keep control of the checkbook. That is a sensitive subject for many older people, so tread lightly. Assessing food and nutrition. Is the older person able to prepare nutritious meals for themselves? Are they able to do their own grocery shopping, or can someone else do it for them? Has there been an unintended loss of weight? Are they expressing a lack of appetite? Is there spoiled or outdated food in the home? If you have concerns in these areas, try to check the refrigerator and cupboards for spoiled or outdated food. The person may be lacking in appetite due to a medical condition, so mention it to their doctor, especially if there has been significant weight loss. They also may just not feel like cooking if it is just for themselves. Southern Maine Agency on Aging's Nutrition Department offers Meals on Wheels and Simply Delivered meals to help seniors maintain healthy nutrition. You can find out more about that on our website. Assessing driving and transportation. Is transportation an issue for the older person, or might it be in the future? Are they expressing less confidence in their ability to drive safely? Are you noticing scratches and dings on their car? Are they getting into fender benders or getting lost driving to familiar places? Whether an older person can still drive safely is a very big issue, especially in Maine, where public transportation options are scarce. The loss of a driver's license means a loss of independence, but public safety must come first. Part of planning for elder care means identifying alternative transportation options if the person cannot or should not be driving. You may need to ask the doctor to intervene and request that the Department of Motor Vehicles call in the older person for a retest. It is a very difficult thing to do, and the older person probably won't like it, but better to lose their license than to hurt themselves or someone else. So now that you've assessed the various potential changes in someone, what action can someone take as a care partner? Well, you can start by assessing your own strengths and limits. Are you good on the phone? Good at gathering information? Can you offer to do grocery shopping or laundry? Are you comfortable with tasks such as personal care? Be realistic with yourself about how much you can do when it comes to elder care. Consider your own financial and emotional limits as well, and how your involvement in the care of an older person will affect your own family and work responsibilities. It is okay and not selfish to be clear that you are able to take on certain tasks, but that you can't take on others. You can help the older person to figure out how those needs can be met, but you do not have to do everything yourself. Setting those boundaries is important for everyone. Learn about available elder care resources by contacting Southern Maine Agency on Aging or the Agency on Aging nearest to where the person lives. Take stock of the older adult's financial situation. Do they have the financial resources to pay privately for the care they might need now and in the future? Or will they need to access state and federal funding to pay for care? The cost of elder care comes as a surprise to many older adults and their families. In-home and facility care is incredibly expensive and may not be immediately available, so planning ahead is crucial. Right now in Southern Maine, in-home non-medical care is running about $25 to $30 an hour, and many agencies have daily or weekly minimums. If a person needs assisted living, it will cost approximately $5,000 to $8,000 a month. A nursing facility can be well over $10,000 a month. It is important to note that Medicare covers very limited home and facility care services, as we will discuss in a moment. Find out whether the older person has a long-term care policy, which will cover some of these costs, and make sure that you understand how to access those benefits when needed. If the older person is a veteran or the spouse or widow of a veteran, contact the VA to see what services might be available through them. Medicare versus MaineCare. This is a question we get a lot. So Medicare is the federal health insurance for people 65 and older, paid for through payroll taxes during their working years. It generally covers 80% of hospital and medical bills, and it does not cover long-term care stays in facilities. MaineCare is the Medicaid program in Maine. The person must have limited financial resources, and their eligibility is determined by the Department of Health and Human Services. MaineCare can cover long-term care when other financial resources have been exhausted. There's a great deal of confusion about the differences between Medicare and MaineCare, and it doesn't help that the names are very similar. Medicare, the federal health insurance that most seniors have, is very limited in the amount of in-home and facility care that it covers. It only covers temporary skilled in-home care, for example, a nurse, an occupational therapist, or a physical therapist, when ordered by a doctor to address a specific medical issue. It does not cover ongoing non-medical home care. Medicare also does not cover long-term care in a facility. It only covers a doctor-ordered temporary rehab stay after a medical event, such as a broken hip. These stays generally last for about 3 weeks. MaineCare, Maine's Medicaid program, is a combination of state and federal funding that helps to pay for in-home or facility care when the person has limited income and assets. A person is only allowed $10,000 in liquid assets under the MaineCare program. Most home care and facility care is paid for either out of pocket by activating a long-term care insurance policy through the VA in certain circumstances, or by accessing state-funded programs if financial resources are limited. Many state-funded programs have long waiting lists, so it is very important to plan ahead, especially if such funding will be needed. Southern Maine Agency on Aging can provide guidance through this process. So how might you get assistance to create a plan? Well, we'll discuss each of these options now. Southern Maine Agency on Aging maintains a database of thousands of resources for older adults on a variety of topics, including assisted living, nursing home care, and many other topics. You can also contact organizations that specialize in the specific conditions that the older person is dealing with, such as the Alzheimer's Association or the Parkinson's Society. As mentioned earlier, there's a network of agencies on aging in all 50 states, accessed through the Elder Care Locator. Options counseling. This basically is looking at what the person's options are for home and facility care and providing referrals. Southern Maine Agency on Aging can offer lists of referrals pertaining to in-home or facility care and speak with you about the process of obtaining that care. Some families may want a navigator to walk step by step through this process and do much of the legwork, in which case they could opt to hire a geriatric care manager to provide this one-on-one, in-depth service. And there's information on the slide about how you might find out about geriatric case managers in the state that you're looking for. Elder law attorneys. Southern Maine Agency on Aging can provide a list of elder law attorneys and legal resources in Southern Maine. Elder law attorneys have specialized knowledge of the complex MaineCare laws and can be crucial in the planning process. They can help families to make sure that the older person's legal affairs are in order. They can do long-term care and estate planning around the possible need for facility care in the future, which is especially important if there are significant assets, a spouse who will still be living in the community, or if there is a secondary property, such as a family camp. It is possible that some assets can be protected from consideration by MaineCare, but it is critical to use an elder law attorney to avoid problems with the 5-year MaineCare look-back period and the potential penalties for transferring assets inappropriately. Power of attorney versus guardianship. There's a great deal of confusion by some older people and their care partners about the differences between a power of attorney and guardianship. A power of attorney allows a legally capacitated adult to name someone else as their health care or financial decision maker in the event that they themselves are not able to make those decisions. POAs are generally revocable if the older person changes their mind. The POA is bound by law to make decisions on behalf of the older person according to their wishes. Therefore, a POA should have a conversation with and be clear on those wishes before agreeing to this role. If a person lacks legal capacity, they will not be allowed to name a power of attorney. Someone would then have to petition the probate court for guardianship in the county in which the person lives, and the physician would have to certify that this person lacks capacity due to a medical condition, often dementia. The probate judge will then decide whether to name a guardian who would have complete decision-making power over the incapacitated adult. At Southern Maine Agency on Aging, we are not attorneys, so older adults and their care partners should consult an attorney if they have questions about this process. Just a little bit more about Southern Maine Agency on Aging. So our core services include nutrition programs, age well classes, health insurance counseling, information and referral, and family caregiver support. We do have other services, although some may look a bit different right now due to the pandemic. We are available by phone or email, but we are not able to meet with people in person right now. We hope that that will happen again in the near future. Our mission is to improve the quality of life for older adults, adults with disabilities, and the people who care for them. In the Family Caregiver Support Program, our mission is to work with family care partners of older adults to provide resource information and caregiver support. We answer phone calls and emails from care partners and provide service referrals. We have some funding through the state of Maine to reimburse families for the cost of respite care for a loved one with dementia if they meet certain criteria. We offer 2 family caregiver support groups per month, open to anyone who is assisting an older adult, regardless of situation or diagnosis. We also offer classes such as this one to educate and engage family caregivers. Being a caregiver can be a very stressful role, and we are here to help support you in whatever way we can. Please feel free to reach out to us at the number on the bottom of the screen if you are helping an older adult with planning for their future needs. Thank you for all that you do.